The TCD Project LLC, Transcranial Doppler Training and Services, Intracranial Stenosis and the Role of TCD, Cerebral Hemodynamics with Intracranial Artery Stenosis, or IAS. The vascular segments accessible for TCD study are relatively short, so CBFV acceleration and post-stenotic disturbance cannot be traced for long distance. The CBFV in the stenosed segment is increased according to the degree of stenosis. Flow is disturbed downstream from the stenosis to a degree dependent on the severity of obstruction. The CBF is reduced. PI is diminished with the delayed systolic upstroke time. Epidemiology Intracranial Stenosis, IAS. Wittig. 22% of patients with TIA or stroke had at least one intracranial lesion, greater than 50% stenosis. Young age, insulin-dependent DM, and hypercholesterolemia favor intracranial stenosis as a cause of stroke. Incidence of symptomatic lesion estimated to be between 2.7% and 8%. In the United States, occur every 40 seconds. That means 2,160. 1 out of 16 Americans will suffer from stroke. Total cost of stroke are estimated in $65.5 billion in 2008. Incidence of the IAS stenosis in the world. 12.9% intracranial large artery stenosis in asymptomatic patients. Elmore et al. 2003. 24% intracranial large artery stenosis in symptomatic patients. Feldberg et al. 2002. 16.4% intracranial large artery stenosis in Chinese patients scheduled for CABG. Yoon et al. 2001. 21.1% intracranial large artery stenosis, greater than 50% in Japanese patients scheduled for CABG, coronary artery bypass grafting. Uehara et al. 2001. Criteria for abnormal TCD diagnosis of IAS. An MCA, ICA, and ACA stenosis were considered if CBFV were greater than 80 centimeters per second. ICA siphon stenosis if CBFV were greater than 65. BA and VA stenosis if CBFV were greater than 60 centimeters per second. Criteria stenosis for CBFV centimeters per second. M1, C1, A1 stenosis. 80 to 99 mild. 100 to 139 moderate. Greater than 140 severe. Criteria stenosis for BB system. 60 to 80 mild. 81 to 90 moderate. Greater than 100 severe. Pulsatility index. Pulsatility index is another parameter used to assess pulsatility and is defined as the difference between maximum and minimum blood flow velocity. Pulsatility index and TCD. Normal values for TCD 0.7 to 1.1. More than 1.2, we can suggest intracranial pressure elevated ICP. More than 1.2 also is suggestion for atherosclerosis. Pulsatility index, PI. PI equals max V minus minimum V over mean V equals S minus D over the mean. Carl Fredrik Lindegaard. He was born in Oslo, Norway in 1946. Graduated from Oslo University Medical School in 1971. Completed his PhD in Oslo in 1987 and a master's degree in health administration in 2002. He became a neurosurgery in 1985. Since 1999, he's a professor of medicine of neurosurgery to the University of Oslo and a senior surgeon at the neurosurgical department, Oslo University Hospital. In 2010, he was appointed honorary member of the European Society of Neurosonology and Hemodynamics. His publications include over 60 papers published in reputed international journals. Lindegaard ratio. Middle cerebral artery, MCA, Lindegaard ratio, LR, has been used as indicator of vasospasm, VSP, following subarachnoid hemorrhage, SAH. However, there have been many criticisms about the ability to detect impending vasospasm using transcranial Doppler, TCD. The Lindegaard ratio. Ratio of MCA velocity to ICA velocity, assuming MCA velocity is high if ICA velocity is also high, LR reduced, thus indicative of hyperemia. Acoustic windows. Submandibular. Submandibular window, located at the angle of mandibula, is used to isonate extracranial ICA. Submandibular approach. Lindegaard ratio. Lindegaard ratio.